Okay, so let's dive in. Today we're exploring a really specific and incredibly important area of medicine.
Ophthalmology, right. The science and care of the eye.
Exactly. It's a field that just demands so much detail, so much precision.
Oh, absolutely. Deep understanding, connecting complex science to, well, real people, real patients. It's quite a challenge to master.
It really is. And the source material we're looking at today, it's actually centered around a resource, something designed specifically to help people navigate that challenging journey.
Okay.
We're looking at a description of a book called 100 Questions and Answers in Ophthalmology by Dr. Atef Ahmed.
Interesting. So we're not just talking about eye care itself, but about how someone might learn it effectively using this specific tool.
Precisely. The goal here is to kind of unpack what this source material tells us about this book's approach, how it claims to make complex topics understandable, learning more efficient.
Got it.
And the source is pretty clear about who it's for. Medical students, ophthalmology residents, other healthcare professionals.
Right. The people right in the thick of it.
Yeah, and the stated goals are quite something. Master key concepts, deepen understanding, prep for exams, and boost those crucial clinical skills.
Which leads to a key point, doesn't it? In a field like ophthalmology, so technical, so layered, how does a Q&A book, actually deliver on those big promises, according to this description anyway?
Good question. We're essentially looking at the design of the book as described and what benefits it claims to offer.
Okay.
So let's start maybe with the why. Why this book? The source seems to frame it as, well, pretty essential if you're serious about ophthalmology.
It does. The description really emphasizes how comprehensive it is. Covers all the major areas, apparently.
Mhm.
It's positioned as, a perfect sidekick for students facing tough exams or even for busy doctors needing a quick refresher.
Okay, comprehensive, that's one thing. But the source also makes this promise about breaking down complexity, making it understandable, efficient, and enjoyable.
Enjoyable, yeah. That word definitely jumps out when you talk about studying complex medical topics.
Right. Efficiency, I get, that's critical in medicine. But enjoyable learning. How does the source say this book achieves that?
Well, the core mechanism, according to the description, seems to be this question and answer format itself.
Okay.
It says each question is carefully chosen by the author, Dr. Ahmed, who they describe as a renowned educator.
Yeah.
These aren't just like simple recall questions.
Yeah.
No, they're meant to be challenging, to really make readers think, engage deeply, not just memorize facts about eye conditions and treatments, aiming for real understanding.
That makes a lot of sense, actually. A good question forces you to connect the dots, right? To synthesize. And then the answers. The source says they're detailed.
Detailed answers for every question,
Yeah.
providing insightful explanations and, importantly, up-to-date clinical information.
So that combination, a challenging question plus a thorough current answer that's presented as the key to making the knowledge stick.
Exactly. It's apparently about understanding the why and the how, not just the what, helping bridge that gap between, textbook theory and what actually happens in the clinic, practical application.
Okay, bridging theory and practice. Now, here's something else the source highlights that really caught my eye, developing critical thinking and clinical decision-making skills.
Yeah, that's a big step up from just knowing stuff.
It is. How does a Q&A format supposedly help with that? That seems like a different kind of learning.
Well, think about it. Making decisions in ophthalmology, it's not always black and white. You weigh options, consider nuances for each patient.
True.
So a Q&A format, especially if the answers provide that clinical rationale like the source describes, it can kind of simulate that thinking process. You tackle the question, pull up the knowledge, then see why a certain approach is taken. It's like practice for your brain.
Okay. Like mini case studies almost, framed as questions.
Sort of, yeah.
Yeah.
It forces that application step. And then seeing the detailed reasoning reinforces the right pathways.
And crucially, the source mentions it includes the latest advancements, which in medicine is always a moving target, isn't it?
Absolutely essential. You can't rely on outdated information. So a resource promising to be current is ticking a really important box for professionals.
Definitely. And the breadth of coverage is mentioned too.
Oh, yeah. Strongly emphasized. From the absolute basics, eye anatomy, physiology, all the way through to complex diseases and how you treat them. The source suggests it covers that whole spectrum pretty thoroughly.
It sounds like quite the undertaking. The source also gives a little background on the author, Dr. Atef Ahmed.
Right. Described as a seasoned ophthalmologist, an esteemed educator.
Yeah, lots of experience, passion for teaching. That background kind of lends credibility, doesn't it? Suggests the questions and answers aren't just academic exercises, but grounded in real-world practice and teaching know-how.
It adds weight, definitely. It suggests the material is filtered through someone who's actually done it and taught it,
Yeah.
making complex things clear,
Yeah.
understandable that often comes from deep experience.
Okay, so if we boil it down, what the source tells us about this 100 questions and answers in ophthalmology book, it's presented as this powerful learning tool
Designed to really solidify what, help you apply it practically.
and develop that critical thinking piece
Mm.
all through this Q&A method.
Yeah, and the scope is key, too.
Yeah.
The description highlights that journey. It takes you on from the very foundations, the basic structures and functions of the eye,
Right, the anatomy and physiology.
through understanding what can go wrong, the pathology, and then figuring out what to do about it, the treatments. It's like a structured path through the whole field,
Yeah.
just using questions.
It is. And for you listening, if you're in a situation where you need to get a solid handle on a complex field, maybe relatively quickly, but also thoroughly.
Which is common in healthcare.
Exactly. A resource described like this seems aimed directly at that need. It's framed less like just a textbook and more like a guided way to build practical understanding, cutting through the noise.
Which really brings us to a final thought, something for you to mull over. Given the journey this book, according to the source, is designed to guide people through, starting with the intricate basics of how the eye even works, then layering on diseases, diagnosis, complex treatments, what does that whole vast scope and the specific need for a tool to help you think critically and connect theory to practice, what does that tell us about vision itself, about how incredibly complex it is, maybe about the kind of continuous deep learning that's always needed to truly care for it?